This video will help you better understand what treatment in the ICU involves, as well as alternative modes of care that are suitable for your loved one. This video does not replace the need for an honest and comprehensive conversation with the patient's doctor. Covid-19 is a virus that mainly affects the organs that help with breathing. Patients may potentially require more oxygen as a result of this infection. If needed, we will deliver additional oxygen to the patient using nasal prongs, face masks, or high-flow nasal cannula. In the event that the lung failure is severe, the doctor may recommend intubation and mechanical ventilation. Intubation means that a breathing tube will be inserted into the mouth and throat of the patient. This tube will be attached to a mechanical ventilator, which is a machine to help the patient breathe. This will be done in the ICU. What is ICU care? ICU stands for Intensive Care Unit, which takes care of patients who are critically ill. In addition to mechanical ventilation, procedures will be done to insert tubes into the body for monitoring of vital signs and to help with feeding. Besides the lungs, other organs may fail. For example, some patients may develop kidney failure and require dialysis. The dialysis machine temporarily takes over the function of the kidneys to remove waste and excess water from the body. Low blood pressure, heart attack, and stroke are some of the known complications. Long-term regular dialysis may be required if the kidneys do not recover. For patients whose lungs do not fully recover, they may become dependent on the mechanical ventilator to help them breathe. Keeping the breathing tube in for too long may also lead to other complications. In such cases, a surgery may be needed to create a hole in the windpipe to insert another breathing tube. This procedure is known as tracheostomy. Additionally, patients may require medications to keep them drowsy so that they can be less aware of their physical discomfort. These measures are necessary to support the patient's organs while waiting for the body to recover. However, they may cause significant physical discomfort. What are the possible outcomes with ICU treatment? Despite the best of care, not all patients do well. As doctors, we do not want any of our patients to suffer for a prolonged period of time and die despite going through invasive and uncomfortable treatment. The doctor will decide on a case-by-case basis whether your loved one is suitable to be admitted into the ICU. People who have a higher chance of recovery are those who have few or no pre-existing medical problems, who have good ability to self-care before his or her hospitalization, who have not developed severe organ system failures as a result of the acute illness. Understandably, patients who are very old and frail do not tend to do well. Amongst those who have survived ICU, many do not fully recover to their original capability to self-care. This may have a negative impact on their overall quality of life. Is there an option besides ICU care? We assure you that we will continue to take good care of patients who do not want ICU treatment or is not suitable for ICU treatment. At all times, our patients' comfort remains as one of our top priorities. Your loved one will continue to receive oxygen, necessary medications, blood transfusions, and other treatments as long as these are medically appropriate. The medical team may also consider a patient referral to palliative care. What is palliative care? Palliative care supports you and your loved one by providing holistic care that covers physical, emotional, social, and spiritual domains of well-being. Our specialists from palliative care will help ensure that your loved one is comfortable and pain-free. They will prescribe medications to relieve uncomfortable symptoms such as breathlessness, excessive phlegm, pain, and confusion. What is important now? If your loved one is still able to speak to you, we strongly recommend that you ask them about their personal values, beliefs, and preferences in relation to their health and life goals. For example, what do you find meaningful in your life? What do you consider important at this stage of your life to live well? What does good quality of life mean to you? Do think carefully about what we have shared. The medical team will discuss with you their clinical opinion and advise treatment that is most appropriate for your loved one. Please have an open conversation with your loved one, your other family members, and the medical team about your loved one's preferences.